Ghana is adopting a data-driven approach to fighting poverty. Accra, Ghana. On a blistering hot day last week, a team of Ghanaians clambered out of vans into Agbogbloshie, in the capital city of Accra. Their eyes roamed over, but they hadn't come to buy anything. They were there to hunt. Ghana is preparing to conduct a census next March. This was a trial run. The people picking but the enumerators were determined. And for the first time, I had the opportunity to observe them on a trip sponsored by the Global Partnership for Sustainable Development Data, hosted at the United Nations Foundation, which supports UN causes. They invited journalists. The census is a huge part of that. Although it can be recognizing this, Ghana wants its new census data to be more accurate, comprehensive, and granular than in the past. In addition to the government is now seriously committed to a leave no one behind ethic, which means counting every single person in the population. That includes people. These people are harder to reach, but without counting them and identifying which places they're concentrated in and which services they lack, it's difficult to design targeted interventions that will actually help them. Ghana and other sometimes called West Africa's golden child, Ghana was the first country in sub-Saharan Africa to cut its poverty rate in half, thereby achieving the first of the UN's, a list of 8 targets that world leaders pledged to meet by 2015. By 2013, Ghana had already lowered its poverty rate from 52% to 24% of the population, according to Omar Saidu, the principal statistician at the Ghana Statistical Service. That sounds impressive, but when researchers disaggregated the data, they found that in some regions, over 70% of people were still below the poverty line, Saidu said. In 2 districts, sometimes, hidden within the global data, there are inequities. You have to unpack. One of the major critiques of the Millennium Development Goals was that some countries saw improved conditions for people who were just below the poverty line, but the extremely poor weren't better off. So when the UN, if you don't want to leave anyone behind, Saidu said, you need to have basic information about people at every level of society. Ghana hopes to inspire neighbors in the region to increasingly adopt this data-driven approach, which has found strong supporters among the country's current political leaders. At a May 21 dinner for visiting journalists in Accra, Vice President Mahamudu Bawumia, an economist, spoke glowingly about the many new ways his country is leveraging data. That includes this way you can target services to people, once you know where they are, Bawumia said. In the course of Ghana's census will take place over 3 weeks next March, not a lot of time to survey a population of approximately 30 million people. But the preparation, for the first time, enumerators will use digital tablets to survey the population, which will allow answers to be checked for inconsistencies or omissions in real time. Electronic map. Meanwhile, government officials will be using satellite imagery to identify all housing structures in the country. After the enumeration, this allows us to determine which areas may have been missed, explained Araba Forson, a chief statistician for the Ghana Statistical Service. Usually Ghana is spending $84 million to carry out the 2020 census, Forson said, compared to $54 million in 2010. Adding the new technology, on the night of March 15, enumerators will go out and endeavor to count all the people sleeping outdoors. They'll wake up the leave no one behind agenda also means that enumerators will go to hospitals to count the people there. I tagged along with, here, enumerators can't survey patients directly. So instead nevertheless, the enumerators go from locked ward to interview nurses and administrators, who sit behind desks piled high with paper records and go through them one by one. On their tablets, it's painstaking work, but Forson said the lessons Ghana learns from this process will be passed along to other African countries like Sierra Leone and Senegal, signaling perhaps the growing embrace of evidence-based thinking and data-driven approaches in developing countries. Twice a week, you will get a roundup of ideas and solutions for tackling our biggest challenges: improving public health, decreasing human and animal suffering, easing catastrophic risks, and to put it simply, you getting better at doing good.
Raindrop, drop top, smoking, no cooking the hot pot. Cracking, fucking on your bitch, yeah, that. Looking up, open the park, pot.